First generation devices, if you want to call them that, generally were 3B devices, and they were typically used only for pain and mobility applications, with some limited application in wound healing respects. And wound healing being more of a surface condition, they were able to get a pretty good result with that. Where those devices typically struggled is the amount of energy delivered at the same time at the target depth, and falling short of that ideal amount, if you will. It's called biphasic dose delivery. If you're on the front end of that biphasic dose delivery curve, you tend to require more treatments for longer durations, and you do not see what we would call the rapid and dramatic response that really sells this device and sells its treatment to your clients. However, they would work and work fairly well. From a purely logistical standpoint, where they would struggle the most would be the longer duration of treatment times. As time is money in the clinic, it becomes difficult to justify spending 30, 40 minutes treating multiple areas on a large dog. So the applications were typically limited to pain and mobility and some wound healing with those first devices. If you fast forward to the higher power devices, now you've got the ability to evoke a rapid and dramatic response. The concern is you've got very limited ability to control dosing by virtue of that swept application of energy, or moving the probe left to right rapidly over the area to mitigate any thermal concerns. You've got high speed, which is nice, but the path that many have gone down is to say, well, right, if I double my power, then necessarily I can cut my term of treatment in half. And that simply isn't the way that biophysics work. Again, back to the biphasic dose delivery. Harvard, among others, have produced these clinical trials showing that there's an ideal rate of delivery, beyond which point you're going to get a result. But you're also going to very rapidly go right into bioinhibitory territory, where you can start to get collateral tissue damage, thermal issues, and so forth. So simply cranking up power to get it done in half the time really isn't an option. However, when you deliver energy in the way that those first generation high power devices are required to deliver them, you necessarily have to dose higher because you're sweeping that probe left to right over your target area. You have to use a substantially higher dosage to get to the same result. With MLS, because we're able to treat in a specific point or stationary method and get all of the energy with no compromise to the target, we're able to do it extremely rapidly. We do pulsed, we do continuous, we do 2 wavelengths, analgesic and anti-inflammatory, same place, same time, exact same target, and by the way, precisely controlled dosing. So we're able to be far, far more efficient with that device, and there's never the concern about thermal response. As far as the ability to get repeatable results, it's important if we're treating, let's say we've got that old arthritic animal, and we want to increase his dose a little bit to get a jump start on the results of this treatment. I can know that I'm delivering an exact dose amount, I'm delivering it to an exact area, and the technician who comes in behind me 2 days from now can do the exact same thing with no guesswork, no motion of the probe, no trying to figure out and back into an estimated total dosage amount. I can get precise results. What this means is when the client brings the animal in, the results that they got on Tuesday and the treatment that they saw on Tuesday is going to be just like the treatment that they see on Thursday or Saturday or Monday and so forth. They're not going to have the animal reacting differently with different people holding the laser. They're not going to get a negative reaction. And quite frankly, we've had animals fall asleep as we're lasering them because there's such a comfort factor related to it that they go right out on the table. And this includes felines who are notoriously fractious at times. So that the ability to be consistent and the animal learns to trust. If you overheat an animal one time, their trust factor is done. And as soon as they hear that laser beeping or they realize what they're there for, now they make that association and now you've got a problem. We never have that issue.